Good afternoon. My name is Dave Kerner, serving as County Mayor here in Palm Beach County. It is September 4th, 2020, day 172 of activation at Level 2 at the Emergency Operations Center related to the COVID-19 pandemic. I'm joined today by some colleagues here today. To my left and your right, Commissioner Greg Weiss. To my right, Commissioner Mac Bernard, and then of course to my right, Dr. Alonzo of the Department of Health. The following speakers at the press conference will be speaking on various topics today, including myself, Dr. Alonzo, our County Administrator, Ms. Virginia Baker, Patrick Rutter, Assistant County Administrator, who will comment on the COVID education and compliance team, and then Commissioner Mac Bernard, who will have some information about the census that is upcoming quickly. I will also be speaking after they have spoken to answer questions regarding some of the content that I'll be delivering here today. I wanted to go over briefly some recent numbers and trends in Palm Beach County. As you know, the Board of County Commissioners has made some important decisions related to the future of the economy and the school system and way of life in this county, and that was done after a very public, very open and transparent process with the public. As we sit here today, the county is at a 3.6 positivity rate. It is one of the best in the state of Florida. On Thursday, the state of Florida had a statewide positivity rate of 5.1%. We've added 119 new cases today, 4 new hospital admissions related to COVID-19, and an additional 10 deaths related to COVID-19. The previous positivity rates over the last several days are as follows. On Thursday, it was 3.6. On Wednesday, it was 4.37. On Tuesday, it was 4.15. Monday, August the 31st, 4.19. Sunday, August the 30th, 3.16. Saturday, August 29th, 4.16. And Friday, August 28th, 4.46. Our hospital admissions remain stable and low. The capacity in our hospital system, both general and in ICU, also remains low, with very sufficient capacity for anybody that needs to get health care in this county, whether it's related to COVID-19 or not. As has also been reported previously, I had the honor of meeting with Governor DeSantis privately in Jacksonville, Florida yesterday. We had a very long discussion, a very detailed and substantive discussion related to COVID-19 and how this county has been able to deal with it with the strong support of the state government. Obviously, there are 3 counties that we're all aware of that have been carved out of the Phase 2 plan, that is Miami-Dade, Broward, and Palm Beach counties. As you'll recall, this county became into a place of safety enough that we were able to move into Phase 1 first out of those 3 counties. That means that we captured very important time in this process to repair the economic health in this county. From there, the citizens of Palm Beach County did what they needed to do, and there was a social contract between this government and the residents of this county about moving forward in a safe, deliberate, and well-reasoned manner, and that's what brings us here today. You'll recall that the Board of County Commissioners voted 4-2 to move to Phase 2 in a phased, structured way that will allow us to open up the residual amount of this economy that's remained closed, but also do it during a time where the anticipation of allowing 180,000 public school students back into our brick-and-mortar school system. Obviously, in the background of all that is the virtual option that remains in effect. You'll also recall that I had a private meeting with County Administrator Baker, Dr. Fenoy, Chairman of the School Board Frank Barbieri, and Deputy County Administrator John Van Arum, along with Dr. Alonzo, to discuss the operational readiness and effectiveness of the school district's plans to open. They indicated at that time that they would require more time. Specifically, Dr. Fenoy indicated that September 21st would be the most ideal date for students to return to this school. And I'll talk a little bit about what has transpired since then. Yesterday, during the meeting with Governor DeSantis, he mentioned that this county is performing as one of the best, if not the best, in the state in terms of combating the pandemic. He was excited to receive our phased replan approach. It is a guideline that's been put together by our administrative staff with the oversight of our incident commander and county administrator, Ms. Baker. That plan was revealed to the public. A very open, very passionate debate occurred about where this county should go, when they should do that, and how we should do that. After that vote was taken, a letter was transmitted to the governor. I delivered it personally to him in Jacksonville yesterday. He was excited to receive it. He was excited to announce recently that Palm Beach County will be the first of South Florida counties to move to Phase 2. I'll talk about the substance of what Phase 2 means in this county, what it will look like moving forward, what will be open and when, and also I'll talk about the discretion that the governor has given us to open in our phased restructuring program so that we have the latitude and discretion to open the remaining parts of our economy safely and effectively. Before we get too deep into that substance, I would like to call Dr. Alonso up to the podium to speak about some of the general health metrics and criteria that are present in this county. Dr. Alonso?
Good afternoon. I am very excited to be here along with the mayor, our incident commander, our county administrator, Ms. Baker, and some of the commissioners, as well as the ones that are not here. We have been under the state goal for our daily lab positivity numbers since August 4th, and with a steady downward trend to achieve our county goal, I call it, to be below 5. Why? Because below 5 is where we can do effective contact tracing. We have been at 5 for 14 days since August 17th, and that makes all the difference in the world. That means that our viral load in the community is going down. Now I say going down. The virus is not gone. The virus has not disappeared. Our daily total people positivity in terms of the cases is also going down now. It was up at 13 on August 12th and the 13th at 13.3, and then it began to slowly go down continuously until August 30th, that it actually reached 12.98. Today, and we go into the weekend at 12.86. So we've had a very successful month of watching all the metrics that we've been following fall in place for the reopening into Phase 2. But notice what we're saying. We're saying a careful and measured opening. In other words, we're going to be watching and giving time in between opening one section of businesses, giving us time to look at our numbers and make sure that we're not having an upward trend. That is critical because we want to keep moving and keeping it low. Now, we may see a small uptake as we have opened the universities. We have been in contact with all the universities to know the plans that they're utilizing. We will be doing contact tracing to ask the pertinent questions that we need to ask to find out where people are becoming positive. And with it being at 5%, we have a much better picture. People can give us better answers. Our community health workers that have been working in the community now for several weeks are able to tell people to be looking for our calls. We have stressed to the community what it is that we're going to ask them so that they know who they've been in contact, make a list, and be able to answer all the questions that we have. What has led to this success? This success has been by all of you that are watching this press conference. It's cooperation and participation from the majority of our residents who have put their trust in us, our visitors and our businesses, the majority which are following our mandates of facial coverings at all times, maintaining a physical distance of at least 6 feet, personal hygiene and disinfecting common touch surfaces, staying home when you're sick, and avoiding the 3 C's, crowded spaces, closed-in spaces with poor ventilation, and close contact spaces or activities. The other part that has done a tremendous job is the COVID education and compliance team by stopping the bad actors from having the late night parties or music events where people start drinking, they let their masks down, they start having fun, and it's affecting that age group of 15 to 45, okay? That's the number that has the most number of new cases, and that has been true for several weeks. So with the ability to do effective contact tracing, being able to get that history from people of where they've been, where they have been in contact and in crowds, in addition to the boots on the ground of the COVID team going out and looking at the businesses, we've been able to decrease that ability to have that spread in those types of locations. So we have to continue doing this, and we have to continue having the cooperation from all of you that are watching, including you, the press, who help us get this message out, that it is more important than ever to continue to wear our facial coverings and our social distancing. That's the only tool we have to fight a pandemic. I said that the very first day, the very first press conference that we had. That's the one tool we have, and we got to keep utilizing that. Like I said, the virus is not gone. We do not have herd immunity locally or nationally. We have a long way to go before that happens. Now, we're all hoping for the vaccine to come as soon as possible. We don't know when that will happen, but we're looking forward to it. I believe this county can continue to do these efforts so that we don't slide back up into a second wave. Now, what am I concerned about? Of course, I'm concerned about the hurricane season. We have a very active season. We're already on N, and September is our highest activity, so we've got to keep an eye out on the weather and keep an eye out on our hurricanes. But the other part is that the flu season is upon us. As a matter of fact, my assistant tested positive for influenza A and B at the same time. And I'm sharing that because she wants me to share it, to let people know that flu is around. So get your flu shots. Please encourage anybody that you know, if never before, this is the season to get your flu shot so that you can distinguish that from the COVID. Now, you're going to see a lot of bad publicity stories on Facebook or whatever entertainment social media you use. They are false stories. There's one going around saying that the flu vaccine actually increases your chances of COVID. And they assured us that that was a reputable, and go look it up. Well, Dr. Alonso did go look it up. It's a completely fake article. They take the label of a known journal, they slap it on a printed page, and there you go, proof that, and people believe this. So what happens is when you click on that website, you're now getting all those false stories, those bots or whatever it is, all that technical stuff. I don't know anything about it, but the part is that you're getting all this fake and bad information. Don't share that. You're spreading the bad news. So when you see something that looks a little kooky, it's probably kooky. Use the reputable websites, the CDC. Those are the guidelines that we're following. Go on floridahealth.gov. We have links to the sections that are important for the COVID. The other thing is the ability to get rapid antigen testing and antibody testing. We are at the point very close that we will be able to have 15-minute tests that will tell you very distinct if you are positive or not. That will make a big difference in terms of having testing. And we're going to continue to look at our metrics and look at hotspots in the community where we can send our mobile units out for testing to keep everybody safe. So with that, we have a long road ahead of us. This is by no means done, but we're in a much better situation today than we were a month ago. So thank you for all your cooperation. Thanks to all the residents in this community, the majority which are following our suggestions, and keep up fighting COVID.
Thank you, Dr. Alonso. I'd like to call now to the podium our County Administrator and Incident Commander, Ms. Virginia Baker.
Thank you, Mayor, and thank you for being here. This has been a long voyage for all of us, and it will continue to be. but we can again start to see more rays of sunshine coming toward us. We are beginning to see our personal sacrifices pay off. We're able to open more and more businesses, to put more of our residents back to work. And we were simply elated that the governor allowed us to move forward into phase 2. The governor, as the mayor stated, he personally delivered the letter to the governor along with our plan that the Board of County Commissioners approved. It is an incremental plan. I did speak with the governor's office just shortly to ensure that we were on the same page based on the EO that they just issued. And yes, we are moved into phase 2 in an incremental manner. It is in accordance with how he carved out southern Florida, that's Broward, Dade, and Palm Beach, and allowed us to move in a fashion that meets our unique needs in our county. And so EO 39 Section 4 allows us to create the plan that we've created, and the governor has blessed. It is important we continue to conduct ourselves in a responsible manner that we brought us here where we are today to move into phase 2. This weekend is a critical weekend, and whether we remain under the 5% positivity daily rate or we spike. So please conduct yourselves accordingly. Wear the face mask, distance, wash your hands. Often avoid crowded places, close spaces, and close contacts, the 3 C's that are critical. In addition, we want our kids to move back to school as soon as practical. And again, by implementing these particular steps, we will continue to keep our positivity rate down, and kids will be safe to go into school. Our CECT team will be visiting businesses and events over the weekend to continue to educate businesses and ensure compliance. So please work with us when they come into your shop. It is my intent to sign our EO, which will allow us to implement phase 2, step 1 of our plan. So you should see that by the end of the day. So again, stay safe this weekend, stay responsible. Mayor?
Good afternoon, everybody. Pat Rudder, Assistant County Administrator, and kind of echoing what Ms. Baker just said, the COVID Education Compliance Team will be out throughout the weekend, working with our businesses, helping them understand the world we're in right now. You know, the big change we've had so far, we had an order that was amended yesterday, changing our closing time to midnight. That will be a point of emphasis tonight and throughout the weekend as we'll be out and about. As we go back to when we began this work in mid-June, we received over 6,000 inquiries between our phone line and our email line. And to date, we visited almost 2,500 businesses throughout the evenings and daytime, following up on a number of these calls, and continue to do so. Again, we'll be working throughout the weekend, tonight, tomorrow night, into Monday, working with folks, helping them understand, and again, as Ms. Baker indicated, with the new order moving into our step 1 of phase 2, there will be further education, and we are more than prepared to do that and spend the time with businesses, helping them understand you've got many that have not been open to date, and it'll be almost a new thing going on. And we're prepared to spend that time putting in, helping them understand the requirements that will be part of the reopening, bringing everybody into a state of knowing what they need to be doing to keep this positive trend we have going, keep it moving. Our primary focus will continue to be education. We do have those that do need enforcement. To date, we have been part of 27 business closures at times, and then we've also had to issue 61 notices of violations. So, and some of those have now moved into the phase where those notices of violations are going to be before our magistrate next week. I think we begin. So we've reached that point where some of them have gotten to that level. Again, we can't emphasize it enough. We'd much rather talk, answer questions, work. There's so many best practices that we've seen businesses employ. And I can't say it enough, the great overwhelming majority of businesses are doing fine or extremely receptive to ideas, thoughts, discussions when we're out. It's these very, very few that do need further guidance, and we will take that step as necessary. So again, we'll be working throughout the weekend. Want to keep this positive trend going. The community's done a great job so far. Let's keep it going. And with that, I'd like to introduce Commissioner McBernard.
Thank you very much, Mr. Patrick Rudder. This is County Commissioner Mac Bernard, County Commissioner for District 7. Just want to thank all of the residents of Palm Beach County for working with us to get to this point where today we're going to announce Phase 2, Step 1, which will begin on Tuesday. And the only reason why we're at this point is because the residents have worked with us, because we're dealing with an economic crisis and also with a health crisis. So, however, residents, we still need your help to help us complete the census. The latest response rate for Palm Beach County is at 62.4%. The state of Florida, the response rate is at 61.8%, and the census has begun reporting statewide response along with the non-response follow-up done by field workers. And according to the latest numbers, the field workers have added an approximately 16% to the state of Florida, which means that the state of Florida right now is at 78%. Now, this is really, really good news. The residents are responding to the census takers that are coming to their doors. And we're asking our residents to please continue to allow them to come to your doors so in that way we can get everyone counted. The census takers will continue to follow up with the non-responding households in person and will follow CDC and local public health guidelines when they visit. We've got to update, we've got to check with the census so in that way we can get the actual numbers for Palm Beach County, but they don't have it up yet at their website. But what we want from all of our residents is 100% of Palm Beach County must be counted. We have 26 days left. September 30th is the last day for the census. We must make sure that everyone in every household in Palm Beach County is counted. There are billions of dollars at risk. Those dollars are necessary for health care, public safety, nutrition, infrastructure, senior services, and child services. The Census Bureau will follow up with some non-responding households. The census will be contacting residents by phone and by email. In addition to contacting households through the new methods, the Census Bureau is increasing other outreach efforts doing one last push to encourage everyone to respond to the census online, by phone, or by mail. The Census Bureau recently announced that it has launched a mobile questionnaire assistance, a program that offers assistance with responding at locations such as grocery stores and pharmacies in low-responding areas. Again, residents, please help us by completing the census. We have 26 days left. Thank you very much. And now I'll bring Mayor David Kerner.
Thank you, Commissioner Bernard. So let me discuss now what all this means in the most practical way that I can. We know where we've come from. There have been difficult times in every state in this country and in most countries throughout this world. We have gone through some difficult times in this county as it relates to the pandemic. During that process, like I've mentioned before, we moved as aggressively as possible in the safest ways possible to ensure that public health was always protected, but while trying to mitigate some of the economic damage that has occurred throughout Phase 1. And with that, we opened first in South Florida. Today is a proud day in a lot of ways for Palm Beach County. Without trying to take away from or minimize the dangers and the difficulties that we have ahead of us, today is a proud day where we are at a very low positivity rate. We have the infrastructure ready to move into Phase 2 from a governmental perspective, from a testing perspective, from a public health perspective. We have approval from the governor in his executive order that once again has given us the local control and discretion that we need. And so on September 8th, this Tuesday, we will move into Phase 2. And just a very brief overview of those businesses that will be allowed to open in the initial stage of the county administrator's executive order are as follows: bowling alleys, escape rooms, movie theaters, playhouses, skating centers, trampoline centers, other indoor entertainment venues, restaurant and food establishments will have their capacity and rules relaxed to a certain degree, and the following may operate at full capacity: in-store retail, museums and libraries, personal services establishments, including but not limited to tattooing, body piercing, licensed acupuncture, and massage establishments, and then also gym and fitness centers. I'll also remind the public that this county actually moved 2 business industries into operation prior to Phase 2 with a special exception from the governor. Those were tattoo parlors and tanning salons. So after the executive order is executed, I would say that probably close to 95 to 98% of businesses in this county will be back open in some form or fashion. Those businesses that will remain closed in the initial phase, Phase 2, Step 1, are auditoriums, bingo parlors, comedy clubs, concert houses, bars, nightclubs, hookah, cigar, smoking bars, arcades, and billiard halls licensed as such. Let me speak about bars. We understand that what I've learned in this pandemic is this, and I've learned a lot of things, but one thing that the public needs just as much as any other aspect in this response is finality, is a timeline, is to know where they're going. And for the vast majority of business owners in this community, we now have that. We will have more clarity on when children return to school, so our parents will have clarity and finality in knowing when their children can go back to school. Bars will not have that today. As we know, the governor, through the Department of Business and Professional Regulation, had put a statewide mandate that closed those bars. I suspect we will hear something about the bar situation in the very near future, but as of right now, this plan cannot and will not contemplate the reopening of bars because we do not have that authority. Where else are we at? We're also aware that on September 8th, we officially enter Phase 2, which has immense implications on the return of our children to brick-and-mortar schools. By law, under the plan approved by the school board and by the Department of Education, the school board is required to open brick-and-mortar schools on September 14th, 2020. As you're aware, in my conversations directly with the school district administration, they felt more comfortable in light of the progress that's been made in this county in moving to Phase 2, that September 21 would be a more ideal and safer date. Taking that information collectively in my position, not just as the county mayor, but as a resident, as a product of this public school system, having heard from teachers, students, and the like, it was my personal opinion that we ought to try to accommodate a move to September 21st to open the schools. And that cannot happen without the approval of the chief executive of the state, Governor DeSantis. As I've mentioned before, I did make that personal request to him yesterday. I've heard from the governor's office today, just recently, that they are willing to extend the opening date till September 21st, 2020 to open brick-and-mortar schools in Palm Beach County. Now, let me be clear when I talk about clarity and finality about when the children can go back to school. That is not the ambit of my position or my office or of this county commission or this county government. I've informed the school board and the chairman of the school board that they now have the option to return on September 21. What they do with that new discretion and option is up to them. From a personal perspective, I suspect that they may need to meet as a board to effectuate that. There may need to be some communication with the governor's office if they choose to do that route, and it will be memorialized in an executive order. But right now, parents in this county need to know that at some point between September 14th and September 21st, brick-and-mortar schools will open in Palm Beach County. I think that for the parents that are frustrated that this option is on the table, let me just say this. We all have a unified vision of what we want to see in this county, and that's a return to normalcy. We all want our children back in school, but we want to do it in the safest and most effective way possible. And if those 7 extra days give the operational effectiveness and readiness for the school board to open safely or more safely, then I think the 7 days is something that should be considered. And I think it's done in a way that mitigates a lack of clarity or finality. It doesn't hold off school districts to opening in October or November. And for example, in Broward and Miami-Dade County, parents and children there don't have on the horizon even a potential opening date for their schools. So I would just ask for a little bit of continued patience while the school board processes this new information and responds and reacts accordingly. As you've heard also, Labor Day is upon us. The beaches will be open in this county. I'm sure they'll be used at high levels. Just be cautious out there. I do believe that the town of Palm Beach has their beaches closed. That's not a decision that the Board of County Commissioners made. But by and large, the vast majority of our county infrastructure, recreation-wise, it will be open this weekend, and we hope that our residents enjoy that. All right, well, we can go to questions, and we have everybody here that can answer whatever question from whatever substance or wheelhouse that you want to ask about, but we'll start with Hannah from Palm Beach Post.
So the governor moved Palm Beach County into the state's phase 2. Did he explicitly approve Palm Beach County's plan, or did he have no problems with it, or did he have any comments?
The comments that were made to me from the governor and the governor's office as I went through this process and personally met with them and have spoken with them over the last several days on several occasions is that they want to see us open up as quickly and efficiently as possible, but their focus, like ours, remains on safety first. We've demonstrated before that we can open up a large urban county in a safe and measured approach, and they gave us that discretion to do that in phase 2. And so that discretion will be utilized. What has been approved by the board and delivered to the governor's office in those guidelines are just that. They're aspirational goals. They are not self-executing. The county administrator will have a series of orders that she signs throughout this process with my oversight on behalf of the board and with the oversight of the Board of County Commissioners as a whole. And so changes to that plan may be made. We may be moving more quickly into the further steps of phase 2. We may slow down. Remember, this is the first large county to be doing this in conjunction and simultaneously with a school board that has more students in that district than Martin County has total residents in their entire county. It's an ambitious undertaking, but it's one that is of the highest importance, and we will execute our plan in a way that accomplishes public safety.
Does the county have the manpower to be able to do random spot checks in education as more businesses are going to be reopening?
The question was, does the COVID education and compliance team that works under the umbrella of the county government, is there enough manpower to continue this effort, which has been very effective? You've heard Dr. Alonso say that on several occasions. The answer is absolutely yes, and I can tell you why. We do rotate manpower in and out of that unit. There are officers and deputies that have other assignments that work at night, that have to be moved to a different division. And quite frankly, this is difficult work. It's taxing and challenging, it's late hours, it's in conjunction with the other county duties that these employees have. And so what we've done with the complete cooperation of our municipal partners is make sure that we have a fresh supply of well-respected, compassionate officers and inspectors that go out into this community. And while our focus on the new phase 2 businesses will be education first, the compliance side of it will be just as vigorous as it has been before. And that's the key to our success. We will continue to make sure that it's properly manned and staffed, and if aggregate numbers of officers and inspectors needs to be increased, we will respond accordingly.
Mayor, I have 2 questions. One, since you received word from the governor's office that he's willing to accept your personal request to reopen schools on September the 21st, have you been in touch with the school board or the district? Does it appear that everybody is on the same page regarding that?
The question was, now that I've received formal word from the governor's office on my personal request to delay school openings by 7 days to September 21st, have I communicated that to the school board, and what was their reaction? I have communicated with Chairman Frank Barbieri. I notified him as soon as I was contacted by the governor's office. He's very cautious to speak on behalf of the board, and I can understand that position. I'm in that position on a daily basis. Having said that, I also have spoken with and heard from and have been encouraged by other members of the school board that had and have sincere concerns and fears about how effective the operational plan of the school district really is. I did not have an opportunity to watch the school board meetings, but I've read the newspaper reports about them. I've spoken with school board members. And what I will tell you is that this isn't about fault or blame in any way. This is an entirely new process. The superintendent said that just as recently as last week. They've never done this before. We've never done this before as a county government. Certainly, we did not execute perfectly, but we executed in a way that gave us a lot of institutional and operational knowledge to know about how to combat COVID on a day-to-day basis. A lot of those principles transferred to the school district. And so when I saw the plan personally, I didn't feel comfortable that they were ready to open. I think the school board shares that concern. I think if they meet again, there will be a robust discussion about taking that opportunity that was graciously given to us by Governor DeSantis to open up a little bit later. And that's the essence of intergovernmental cooperation. That's the essence of teamwork. It's not about were mistakes made, it's how do we move forward. And I hope that they take those extra 7 days.
And I just have a question, I think maybe Dr. Alonso could answer. We were talking a lot about the current positivity rate, and you mentioned the word hotspots. Do we currently have any hotspots in the county, and if so, where are they?
They change. So what we're doing now is we're going down to the census tracts and putting in the weekly number in those census tracts. And we're giving this in our meetings with the municipalities so they can see for themselves. And then our staff here at the EOC, under the direction of Mary Blakeney, is going out and cooperating with those municipalities to send our mobile units for testing in those spots. So the census tracts are much smaller than the zip codes, so it makes it much more useful. Also because we're getting that weekly accumulation. So the biggest numbers, if they have, between 30 to 60 cases, and so with that changes weekly. And so that's what they're utilizing. I haven't memorized all the census tracts of how much is in each one, but that's what we're using, and that will change. That makes it much more targeted, and we don't waste time going to places that don't have as many cases as in other places. So we're using that tool.
And in regards to the rapid antigen testing, you said that's a 15-minute test that will determine if you're positive or not, which will obviously be very beneficial. Is there any timeline onto when we could see that here?
The tests are available. We are hoping to get tests given to us from the state. The state got the supply, and so we will wait to have those passed down to us.
I wanted to just clarify something. We know that the school district will be the agency to determine exactly when school will reopen in person, but they have to decide between September 14th and the 21st, that's correct?
Yes, ma'am. So, and the question was, just to clarify, it is the school board's decision when they open to a certain degree, and that is within the time frame of September 14th to September 21. And when we talk about what 7 days means, it's not about the positivity rate changing that day or over that course of that week or the metrics getting worse. Let me just be candid, first of all, that as we open up the rest of the economy and as children do go back to school, which is in the foreseeable future with certainty, there will be a rise in community transmission. But it's at such a low prevalence in this county right now that this is the time to act. But what does that 7 days mean for the school board? Well, I've been a very vocal proponent of having testing on the spot, rapid result testing in our school district, so that these children's schools don't get shut down because of the inevitable exposure that's going to happen at some level. Even if it's just one student to another student, we shouldn't have to shut down the entire school district or school, that particular school, because we weren't prepared with our supply chains and other aspects of an operational response, like on-the-spot testing, like having thermal imaging cameras. I know some of these concepts may inspire a little bit of concern, but we've been using this technology in our county jail system, in our county court system, and it's very effective at highlighting people that have high temperatures as they come into an institution en masse. It does it in real time, and it does it very quickly. Those are the nuanced operational day-to-day things that can really help this very large school district open up. And I think if the 7 days helps them get to that point and resolve some of the administrative issues that they have with making sure that teachers have the confidence that they're not going to have to be forced to return or lose their job if they, if they're in a situation medically that prevents them to do that. I don't know the details of what's gone on, but they've been told one thing and another thing has happened. And they've admit that they need to get their application process up for these teachers. They deserve to have a level of comfort and consumer confidence in going back to their job, and an extra 7 days may accomplish that, which means we may have more teachers that are willing to come back. It means that we have more students and parents who make the decision to return because they feel more safe about the return. Those are important things to these children that have been trapped in their houses because of the pandemic. I know about the social development that's being lost right now. I know about the opportunities for friendship and learning and growing that are being lost right now. And if 7 days, like the superintendent, Dr. Fenoy said and told to me, gives him more confidence that they can execute safely, then go for it.
Mayor,
Please.
I got whispered in my ear, in terms of the antigen testing. We do have the availability of the antigen testing, the quick results at the baseball park. That's being done now for over 65, under 18, and people with symptoms. I was referring to the antigen testing that would be available more readily, and also some of the private folks in town that have testing may also have the antigen testing. The one at the ballpark, they do your test, and they text you or email you back with the results within a couple of hours. So that's being done now.
Dr. Alfonso, would you like now or afterwards a couple of sounds? in
I'll get you
Spanish?
after.
Super,
Yeah.
appreciate it.
All right, are there any other questions? So, yes, ma'am.
Just one more thing, would the county be able to, I don't know, assist the school district if they needed more thermometers,
Yeah.
if they needed more of that equipment that make sure everyone's safe?
So that was one of my the question was, can the county assist in supply chains, supplies in general, PPE, advice, operational plan, institution, things like that? That was the original offer to Superintendent Fenoy. Both Virginia Baker and I had that meeting. We have incredible emergency managers in our government here that do this day in and day out. We want to be and remain committed to be partners with the school district. And that means that if we have suppliers or we have equipment and storage that they need, on a moment's notice, we'll be there for them. But also that the actual technical operational assistance is very important as well. And I think that there's been very good dialogue and communication between the school district and the county government. But we want to be partners in this because we have a unified vision, we want the same things, and the actions of one government versus the other government affects the community at large. If we're going to do this, we need to do it together, and we are going to do it together. Hannah, did you have anything?
Yeah, is there anything that the county's contemplated that might delay the Tuesday reopening? I know it's a short time between now and then, any like health metrics or anything?
The question is, has the county contemplated any reason why the executive order won't be executed and effective on Tuesday? Not that I'm aware of. The county administrator can speak to that better than I can. I doubt that there's any development related to COVID-19 that would transpire between now and Tuesday that would stop us from opening up on Tuesday. And the governor has told us that we will open up on Tuesday, and we will. Well, with that said, I think that we have a lot to be proud of in this county. I appreciate all the hard work and commitment from the public. It is bearing results. Opening first in South Florida means that businesses start running at higher capacity more quickly, which mitigates the damage economically, and we're doing it at a time where the public health and safety is very well protected, and we're doing it at a time where we have the proper infrastructure in place to move forward to continue to do it safely. I appreciate everyone's attention here today, and we'll continue to communicate with you directly.